Guys, welcome back to Medical Coding with Blue. Today's episode is all about what to do if you have failed the RHIT or the RHIA exam and how to recover. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So if you have gotten your college degree, either the associate's degree or the bachelor's degree, and you are eligible to take the RHIT, which is the Registered Health Information Technician, that's if you got your associate's degree, or your RHIA, the Registered Health Information Administrator, if you have gotten your bachelor's degree, and taking it and you failed it, and now you want to retake your exam again in 30 days, because AHIMA does allow a 30-day cooling off period, and then you can take the exam again. And even if you just failed it by just a few points, the way that AHIMA grades these exams is weird, okay? No one really understands it, and but even not passing it by a little bit could mean a lot. And you can tell that based on the domains, because they will give you a sheet that says like what the domains were and what your score was. So if you are scoring very low in every single category, but you barely missed the passing mark, and you think that you can take your exam again in 30 days and be okay, I want you to rethink that. And I'm going to suggest that for anybody who has failed an exam. Do not try to take it again in 30 days. That is not realistic. There was a reason that you failed. And if your scores are very low in every category, then that means you have a lot of work to do. With the RHIT and the RHIA, there are no books involved. You can't take any manuals in there with you, nothing. It is all just what you remember. It's all about recall, recall, memory, and all of these things. So what you have to make sure that you're doing when you have failed is you need to stop and give yourself a few days to kind of get over that sting and then get back into it, back into the studying. You have to be serious about the time that you put into studying. It needs to be 20 hours per week. And you need to get a realistic retesting date, not in 30 days. So you can just throw that out the window, not in 30 days. Because even if you're rushing, trying to get, well, I just need to get my RHIT or I just need to get my RHIA. Even if you are rushing, what happens when you go to these job interviews and they're testing you on your competency, it is going to show. So even if you're just looking for a pass as a pass as a pass, it is still not going to benefit you. And you would have done all that rushing for nothing, because you're going to get rejection after rejection. So let's just take a step back. And again, feel the sting for a couple of days, but then you got to get back on it. You have to look at the calendar and get a date that is more reasonable. I say to wait 90 days between tests. And it used to be that way with AHIMA, but because of like this society that we live in now, everything has to be right now. People don't have patience anymore. And that's unfortunate, because it's going to lead to more mistakes. It's going to be more costly, because if you attempt to take the test again in 30 days, there's a good chance that you're going to fail it rather than pass it again in 30 days. I'm not saying that to be negative. I'm saying that because when I look at people's scores, when they post them wherever on social media, I know that unless something changes with that person's study, that it's going to be the same. And you're just going to keep paying that fee thinking, oh, well, I'll just keep gambling until I pass. Wrong. Then this is your wake-up call to stop and to take the time to look at the calendar 90 days from that day and say, okay, that's going to be my test date. And that's the date you're going to shoot for. And then you're going to commit to studying for 20 hours per week. I say the same thing to medical coders, but it's even more important for people who are sitting for the degree designations. Because again, a lot of it is going to be recall, and a lot of it is going to be attention to detail. Now, a lot of these scenarios are going to have all of the information that is needed in the scenario, for, of course, for you to decide, because you don't have books with you. But you do have to have a strong core foundation of the guidelines. You need to know a lot about a little bit of everything. So I'm going to talk about the domains here, so that way you can kind of get an idea about what's happening with these exams. So your knowledge base has to cover a lot. And the best way for you to be able to have a lot of knowledge in the short amount of time that you are studying is to repeat. Rinse and repeat. That's why I say 20 hours per week. Because when we're looking at these domains, like domain 1 for the RHIT is data content, structure, and information governance, 19 to 25%. So this is going to talk about the health information guidelines, the coding guidelines, the ICD-10-CM coding guidelines that are in your book, CMS, facility or regional best practices, federal and state regulations. That's encompassing what it's all covering, what they're talking about there. Apply healthcare standards for like Joint Commission and meaningful use. You need to understand what meaningful use is, what Joint Commission does, and what is their purpose, and what are the kind of things that they're looking for. That's what they're telling you here in this outline. And then identify and maintain a designated record set. If you don't understand what that means, you need to be practicing that as well, looking it up and understanding what it all means. So then we have maintain the integrity of the health record, audit content and completion of the health record, educate clinicians on documentation and content, coordinate document control, like create, revise, and standardize forms, assess and maintain the integrity of the master patient index, and maintain and understand the data workflow, create and maintain functionalities of the EHR, create and maintain EHR records to ensure data integrity, and navigate patient portals and provide education and support. Domain 2 is access, disclosure, privacy, and security, 14 to 18%. So keep that in mind. Your bulk is going to be the data content, structure, and information governance at 19 to 25%. And then domain 2 is going to be 14 to 18%. Access, disclosure, privacy, and security in domain 2 is going to cover manage the access, use, and disclosure of PHI using laws, regulations, and guidelines, release of information, accounting of disclosures, determine right of access to the health record, educate internal and external customers on privacy, access, and disclosure, apply record retention guidelines, retain, archive, destroy. You need to know when each one of these is supposed to happen, okay? And then mitigate privacy and security risk, identify and correct identity issues within the EHR, like merges, documentation corrections, registration errors, and overlays. Domain 3 is the data analytics and use. That's 12 to 18%, another heavy hitter. So between these first 3 sections, you know that's going to be the bulk of this test. So for data analytics and use, identify common internal and external data sources, extract data, analyze data, report patient data to the CDC, CMS, MACs, RACs, and insurers, compile healthcare statistics, and create reports, graphs, and charts. If you don't understand that, that's something that you really have to work on, okay? Because again, these things are going to be very quick. The timing of this test is 3.5 hours. So you have to do, you have to do these things in very short order. Analyze common data metrics used to evaluate health information functions, CMI, coding productivity, CDI, query rate, and ROI turnaround time. You should be able to explain what each one of those things are. Every single one of them. And you can't say, no. It needs to be natural. So that way you know that you're ready. Okay. Continuing on with domain 4, revenue cycle management, 19 to 25%, another heavy hitter. Okay. So each one of these is really big, right? So we have identify the components of the revenue cycle process, demonstrate proper use of clinical indicators to improve the integrity of coded data, code medical and health record documentation, query clinicians to clarify documentation, recall utilization, review processes and objectives, So again, utilization review, that's something that you have to know forward and backwards. Manage denials, coding, or insurance. You have to know what to do. There's a process, guys. There's a process to these things. Conduct coding and documentation audits. You need to know what is there. You need to know what makes up a complete record, okay? Because just being in the leadership side does not excuse you from that. You are going to be the voice of reason. You're going to be the person that everybody turns to when they need answers, because you are supposed to be the authority, okay? Let's see. Monitor discharge, not final billed. Analyze the case mix index, right? Or analyze the case mix. And then identify common billing issues for inpatient and outpatient. Understand payer guidelines and requirements, LCDs, NCDs, fee schedules, and conditions of participation. Collaborate with clinical documentation integrity staff. Review and maintain a charge description master. Describe different payment methodologies and different types of health insurance plans, public versus private. Compliance is domain 5, that's 13 to 17%. Still a lot, but not quite as much as the other ones, right? The other 4. So perform quality assessments, monitor health information compliance, and report non-compliance in coding, ROI, and CDI. Maintain standards for health information functions, chart completion, coding accuracy, ROI turnaround time, and departmental workflow. And then monitor regulatory changes for timely and accurate implementation. And finally, in domain 6 is leadership, 9 to 12%. So provide education regarding health information laws and regulations. You need to know these things, guys. I mean, again, forward and backwards, you have to know these. There's not an excuse for going through a whole degree program and not being able to answer these questions, okay? Review health information processes, develop and revise policies and procedures, compliance, ROI, and coding. Establish standards for health information functions, chart completion, coding accuracy, ROI, turnaround time, departmental workflow. Collaborate with other departments for health information interoperability. I always trip over that word. Provide health information subject matter expertise and understand the principles and guidelines of project management. So again, these are all really dense subjects. And the best way for you to do this is to study and commit to studying 20 hours per week. 30 minutes in the morning, 30 minutes in the afternoon, 30 minutes at lunchtime, 30 minutes at lunchtime, 30 minutes on your drive home, okay? And then 1 hour that you're reading something or you're listening to something, and then another hour. But I really recommend working with flashcards. Get the AHIMA RHIT, or if you're taking the RHIA, get the RHIA book from AHIMA, because I have heard that a lot of people said that it does really well in prepping them for exams. Now, that it's different for coding, okay? That's different for coding. But when it comes to the degree programs, I have heard more times often than not, there is a resounding sound of success when people have studied from the AHIMA RHIT or the RHIA prep book. So it is very important to go over those things. And again, you don't want to barely pass when you fail, you know, and you go and take it a second time. You don't want to just barely pass. You want to pass with a few touchdowns. And that means to be listening to the guidelines. You can listen to the guidelines if you don't want to look at the book, if you don't want to read. If you go to Microsoft Edge and you go and you type in CMS ICD-10 Coding Guidelines 2024, right? The PDF will pop up. If you touch on a word, the little 3 dots will pop up, and then you can click on that and it'll give you the option to read aloud. And that's how you read aloud. And so it will read to you, but you have to go through Microsoft Edge. If you try to go through Chrome, it does not work. But go through Edge, listen to those guidelines. You can listen to them as fast or as slow as you want to. You could be washing dishes. You could be cooking for your family. You could be doing any of those things, but still getting that time in. And the more you listen to it, the better off you'll be. You know, with adults, it is that we have to have it repeated to us a lot. The key to adult education is repetition. A wise doctor has said that. And she was right. You know, if you are listening and you are repeating it, it's going to stay. Okay? Because again, you want to be prepared. There is no reason to have to keep taking tests because, oh, well, no, I'm a nervous test taker. You could be a nervous test taker all you want to. But I'll tell you what, when you have the knowledge that you need, that those nerves are going to go right away because it's going to be all about you in that test and the speed with which you get through these. And you have to learn to trust your first instinct when you are taking these exams and you're listening to, or you're not listening, but you're going through the questions. You need to go with your first response and move on. If you are sitting there spinning your wheels, that clock is going to be ticking. Okay? The clock is going to be ticking and you don't have time to waste. You really don't have time to waste. Now, if you're taking the RHIA exam, this is the content outline. Let me make sure that this is the correct outline. One second. Okay, let's see. But yes, guys, it is critical. These exams, it is so critical to be prepared when you get these get to taking these. But you don't want to stress yourself out. So that's why I say if you do 20 hours and you commit to that and you do that over a period of 3 months, you're going to do way better than you think, okay? And sometimes we don't give ourselves enough credit. So with the RHIA exam, it is, I'm trying to look for the amount of time that it is. I think it's 3.5 hours. Let's see. Yep. The RHIA is a timed exam. Candidates have 3.5 hours to complete the exam. The total number of questions is 150. There are 130 scored items and 20 pretest items. It is given in computer-based format. The passing score is 300. AHIMA exams contain a variety of questions or item types and require you to use your knowledge, skills, and experience to select the best answer. Each exam includes scored questions and pretest questions randomly distributed throughout the exam. Pretest questions, of course, are not accounted towards the final results. And then the RHIAs have 5 domains, right? So the first one is data and information governance, 17 to 20%. Evaluate the integrity of the health record documentation. Apply knowledge necessary to process the required clinical data elements for quality reporting. Understand and apply data dictionary standardization policies. Manage documentation and data standards based on organizational policy. Complete data analysis to inform management. Develop policies and procedures for health record data, documentation management, and information governance. Comply with retention and destruction policies for health information. Manage the integrity of the Master Patient Index. Domain 2 is compliance with access, use, and disclosure of health information. So notice how it looks a lot similar to the RHIT, but there are differences, okay? And domain 2 for the RHIA is 15 to 18%. Tasks is manage patient access to their health information, including the use of patient portals, advocate for patients and their families in the process of obtaining health information, process health information requests according to legal and regulatory standards, monitor access to protected health information, internal and external to the organization, develop health information request workflows to comply with legal and regulatory standards, follow breach of information protocols, gotta know what those are, okay? Ensure compliance and ensure compliance with privacy and security initiatives. And then we have domain 3, another heavy hitter, data analytics and informatics, 23 to 26%. Support end users in EHR applications, create reports and visual representations of data, use database management software and techniques, audit documentation using a focused tool like CDI, quality, safety, optimize health information and other technologies to improve workflows, support health information exchange solutions, examine software applications and integrations for the impact to health information, understand the information systems development life cycle, including the analysis, design, development, implementation, and maintenance and evaluation phases, validate validate healthcare statistics for organizational stakeholders. Domain 4 is a revenue cycle management, 20 to 23%. Educate providers on various reimbursement models. Validate coding accuracy. Monitor Department of Health and Human Services clinical documentation requirements. Conduct clinical documentation integrity activities in support of revenue and quality improvement initiatives. Support the claims management process. Assign diagnosis and procedure codes and groupings according to official guidelines. Conduct revenue integrity activities. Domain 5 is 23 to 26. So they're all pretty much evenly distributed on here. So everyone is equally as important. Management and leadership, finally. Domain 5. Develop and implement goals and strategies, including change management to support organizational initiatives, demonstrate knowledge of contracting/outsourcing processes, perform human resource management activities, perform and oversee work design and process improvement activities, facilitate training and development, prepare and implement budgets, assist with accreditation, licensing, and certification processes, monitor organizational compliance with health laws, regulations, or standards, and demonstrate knowledge to lead or facilitate project management. So these are all things that you have to know, guys. And again, if you're trying to race through and just pass the test, just barely, it doesn't matter. It does matter, because the association needs people who are competent when they're getting out into the real world. And the industry needs competent leaders. AHIMA, the American Health Information Management Association, is the only association that has these prestigious degree designations, the RHIT or the RHIA. They are the only ones that have them. And so in order so that everybody understands the quality of the people that come from these degree designations, everybody has to be doing their part. And doing your part means to study. And just like I recommended to people who are taking the RHIT, again, that you need to study for 20 hours per week. You need to make sure that you're going over flashcards. Flashcards is a way of rinse and repeat, rinse and repeat. Quizlet is great for flashcards. Now, some of those are wrong because people are making those up. So you may see an error here or there. But if you are constantly reading and studying, you'll be able to catch those. And some of them are pretty good. I have taken the liberty of going through and looking at RHIT flashcard decks, RHIA flashcard decks. And I do this because everybody comes to me on my channel. So they ask me about those. And so I mean, I've looked at quite a few of them and they're quite comprehensive. So it would be great and it would behoove you to review those. So flashcards, flashcards, flashcards. Listen to the guidelines. That's so critical. Now, I've heard from other people who say, well, Blue, my teacher shared your videos with the class and we're all taking our RHIT or we're taking our RHIA. One of the things that you said really stood out, which was read the guidelines. We did, and we did well, and it helped them. So reading the guidelines, the ICD-10-CM coding guidelines is really key. And like I said, if you were listening earlier, you know that I talked about how to listen to them. So that way you don't have to just read them. And practicing your reading speed is going to help you. Okay, guys? That's going to be very critical here because it's just minutes per question, right? You know, just a couple of minutes per question. So you really want to make sure that you are making the most of your time, you're maximizing your energy, and you're studying like you're supposed to. Don't burn yourself out going and trying to cram and study real hard, and then you're going to be upset because something happens and maybe you don't pass again, or maybe you just barely pass, but then all of a sudden when you're applying, you can't pass those assessment tests. So take your time. This is the time to take your time, but set a date on that calendar. Look 90 days down the road. Get your goal to that date, and you say, okay, I'm going to be studying consistently 20 hours per week. And then the week before, take your time off. And that way you can be refreshed, renewed. And as soon as you go in and you take that test, you're going to be ready, because this is going to be very familiar information to you. You know exactly what to study and where to go. And again, having those study manuals from AHIMA is the way to go. Okay, at least that's just what I've been told anyway. So with that said, best of luck to you. Do not rush. Do not take it again in 30 days, guys. Don't do it, because it's just not worth it. Take your time. Go another 90 days, and that is fine. 90 days, there's nothing wrong with it, guys. There is nothing wrong with waiting 90 days to be able to take your test again, because yes, you can do it. But let's be realistic when we look at each domain and what we scored in those domains, and then that's how you can study accordingly. But know that every single one of these tests is going to be different. Okay, I'm just saying. So with that said, I'm going to wrap this one up. Best of luck to you. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.